The following program, Live and Learn, is made possible by Aging Partners. Find out more on their website.
The pandemic has affected normal operations and services provided by Aging Partners. I'm Kristen Stowes, and I'm pleased to have Randy Jones, Director of Aging Partners, return to Live and Learn to give us an update on the services provided during the pandemic. Please stay tuned to hear the progress.
Hi everybody, welcome to Live and Learn. My name's Kim Pachia. Hey, on today's segment, we're going to be talking to our friends at Bryan Health, and we're going to be talking about telemedicine. Stay tuned, it's a new technology, and I think a lot of you will be using it in the future, if you're not using it already.
Dee Aguilar recently retired as the coordinator of the OLLI program here in Lincoln. She has an interesting story to tell about the educational program for mature adults in Lincoln. Stay tuned to hear this interesting story.
Hello and welcome to Live and Learn. I'm your host, Jerry Renaud. One of the issues we've faced over the last year has been the challenge of eating healthy as we eat most of our meals at home because of COVID-19. How can we make sure we're eating healthy and in the right proportions and not getting lazy or taking shortcuts? Today, we want to give you some help. Joining us will be Jill Engel, Aging Partners Service Coordinator, to give us some advice on eating healthy during the COVID crisis. Don't go away.
This and more on today's Live and Learn.
It is a pleasure to welcome back Randy Jones, Director of Aging Partners. I'm Kristen Stowes, and Randy, I believe we are meeting each other for the very first time via Zoom.
Hi, Kristen. This is
Hi.
all right.
This is a medium that has taken over all of our lives, right?
It lets me enjoy my coffee.
Well, there you go. There are positives. It has been approximately 10 months since your offices and senior centers were closed due to the pandemic, but that did not mean cessation of your services.
Oh.
Not at all. Let's talk about how things have progressed by starting with the meal delivery to the senior center clients. How is that going?
Well, that's been a real focus for us. We have people that come into the senior centers that come in for socialization, but a lot of them depend on those meals that we serve for their nutrition and health. And so we've had to expand our service by delivering home delivered meals instead of expecting people to come into the centers, because they're all closed until people are fully vaccinated.
Sure.
We did that in a couple ways. We've been delivering home delivered meals, 7 meals a day. We've also contracted with Tabitha. They normally have a Meals on Wheels program, and we pay for a portion of that. But then we've also contracted to expand their services too.
I see. Well, that's wonderful. And to be honest, this really is more than a meal delivery. This is a social contact for those that are so isolated in their homes.
I've got a real quick story to share. We had one of our drivers was helping with meal delivery, and a lot of the clients come out of their doors because they want to connect with people. And he noticed something was wrong with the client, and the client slumped over in a chair. And so he immediately got medical attention to her, and things turned out well. But that's a side benefit. We're also distributing fresh fruit and vegetables, and then also some comfort kits that have things like masks and PPE and cleansers, so that seniors can stay safe in their homes.
Yes. Well, I'm sure those clients appreciate that so very much. Well, and this leads right into our next discussion about social isolation. That did result with the closing of the senior centers, and it became the basis for a very new program that was established, NeighborLink. Let's start about talking about the parameters of this program. What qualifications might a volunteer need to be able to volunteer for NeighborLink?
Well, there's very few. I mean, there's a lot of different things that a volunteer can do. We connect that volunteer with a senior partner, and they discuss how they can support each other. In some cases, it's just a friendly phone call. We'll check in once a month, once a week. Our mayor signed up for the program, and that's what she's doing, is she's connecting with the senior every few weeks. But there's others where they pick up library books for the senior. They may go grocery shopping for the senior. In one case, I'm aware that the volunteer brought the senior flowers or a poinsettia for Christmas, but it's a way of connecting. And you're right, that helps us with the social isolation, but there's some material needs like the grocery shopping, retrieving library books, for example, where there's some other benefits.
Sure, sure. How do you learn of those who need assistance?
Well, they can just simply call our number at NeighborLink, and we will register that person as needing and wanting a pairing, and the volunteers can do the same thing. It's actually quite safe, though. We do not want volunteers going into any homes. We do background checks on all the volunteers. We do ask that the volunteers are over 18 years old.
All right, all right. How are the volunteers paired with that client?
A lot of times it's proximity. If they're close in proximity, it may be interest. We may have a volunteer that's just interested in doing phone calls. In that case, we can pair them with a partner that is across town. Maybe somebody just wants to volunteer once a month, for example. We would pair that person with a senior where that's all they are wanting. So it's really based on their experience. And in some cases, we have volunteers call and we'll hold them until we have the right match.
Oh, well, that sounds wonderful. It's ideal. So we do need to make the point that this is not a transportation service, correct?
No, that's correct. That presents too much liability for both the volunteer and the senior as well. And we don't allow our volunteers to go in the homes of seniors either.
Yes, that makes sense. Is there a certain amount of volunteer time you expect for someone to give?
Not really. In the mayor's example, I think she's giving like an hour a month, but in other cases, they're connecting more frequently. So it just really depends on the proper pairing.
Okay, all right. Have you had enough volunteers to fill your need? Do you need more?
Well, we do need volunteers. We have some volunteers that have taken on additional senior partners because we don't have enough volunteers. So we would ask the public to sign up for the program. It's very, very rewarding. But I also don't want to, we are eager to also help as many seniors as we can with the program. We're ranging between 50 and 75 pairings for the program. Then it ebbs and flows, but we're very eager to build the program. We think there's a lot of interest and a lot of need, and we're getting some great feedback from the volunteers and partners that these are meaningful relationships.
And that was a question I had. If you had heard from the volunteers on what this is meaning for them, it has to be very heartwarming.
It is. They've developed friendships and met new people that have stories to tell, and it's been very rewarding.
Oh, that's wonderful. Do you think this is a program that might continue after the pandemic is over?
Well, we're already committed to that based on its success. We started it with COVID, but we're expanding it into the future.
Oh, that's fabulous. I think it sounds like a wonderful, wonderful program. So let's put the graphic up very quickly and remind us how someone can volunteer.
Sure. All you simply need to do is give us a phone call at 441-7575. If you want more details about the program, they can go to our website. You can go in there and register, and then we'll work with you to get the background check completed, and we'll make the connection.
Well, congratulations on the success of this program. I think it's wonderful. Your agency then has also been able to take part in a survey on COVID-19 and its impact on aging Nebraskans. Were there findings of this survey that you could share with us?
Yeah, the UNO Department of Gerontology developed this survey. The area agencies across the state participated in gathering the information for the surveys, and about 1,800 seniors participated. And what we're trying to measure is get an understanding of how isolation has impacted the seniors in the state. And so that we can develop plans on how do we address those. And I think we have some graphics related to that.
Yeah, we'll put up that first slide.
Okay, so this was taken about a month ago, so we're 8-9 months into the COVID event, and 39% reported that they feel lonely. That's not a surprising number. We have many seniors who live alone who report feeling loneliness or depression as a regular course. But 35% felt lonelier after the impact of the pandemic. Next slide. And, part of that reason, I think, is because people have done what's been asked of them and staying safe and staying inside. But the sad news is that 25% of the people that responded have not left their home to do anything other than get the mail or newspaper over a week's period of time. And that takes a toll. That takes a toll on your mental health and even your physical health, because the less you move around, you have a tendency to lose muscle mass, and that can create balance problems.
Yes.
The other concern is that 42% have held back on postponing health care due to COVID. And so, unfortunately, what we're going to start seeing is people, usually when you go to your health care appointments, your physicians are identifying problems that you need to address. And so even if it's a routine visit, postponing that can be harmful to you. So we would encourage seniors to continue to follow up with their physicians. Sometimes they can do telehealth, which is web-based to check in. I'm doing a telehealth appointment next week.
Mm-hmm. So
anyway, it's very important that you continue with your medical care.
Yes, absolutely.
And then the last graphic. So part of the challenge for some of us may communicate by email or by smartphone, but 41% of the respondents have neither internet or smartphone, which means that we have to find connections that are people connections, family connections, neighbor connections, telephone connections. We can't always rely on what the younger audience does to connect with each other, like this Zoom meeting.
Yes, there's definite learning curve there. It's not intuitive.
So, the University of Nebraska Omaha and University of Nebraska Kearney and the gerontology department did a great job of providing us this detailed information. And we're working with them and their students on how can we address these going forward. Social isolation is a reoccurring issue for seniors. And I ask our audience that if you don't have a senior as your friend, or if you don't have a senior paired with you that you support, we need that kind of support from the community for our seniors.
Yes, absolutely, absolutely. And pairing on with the physical exercise then, the fitness centers are still closed and the Zoom classes are still the norm. How do you feel on the success of that?
Oh, it's awesome. It's a new way of us bringing fitness classes into the home of seniors. And I would encourage seniors to call us at 441-7070. Get signed up into our fitness program. We do hope to open here in the near future now that the vaccines are coming out, and at least a partial opening of our fitness center. Okay. Maintaining fitness, physical health, and muscle strength is so important to enjoying our life in our senior years.
Yes, it certainly is. It certainly is. Well, Randy, we have only about a minute left. Do you feel like Aging Partners will be providing any assistance or direction with the COVID vaccine rollout, which is on the horizon now? Very exciting.
Right. Well, just today we learned about some new vaccine sites that are being developed. We're working very closely with the health department to support seniors through that process. We would encourage all seniors, especially those with chronic health conditions, to make sure they get their vaccines. It's so very important.
Yes, it definitely is. Well, I know we have all learned so much from this pandemic environment. Do you feel like there are things that you've learned that you will carry on after the pandemic is over? Are you optimistic about the future?
Oh, I have great hope, and we have learned a lot, and I think this has brought an awareness in the public about the need for us to care for each other.
Yes, it definitely has that. Well, Randy, thank you so much for your optimistic attitude about continuing to serve our aging population. Thank you for all of the assistance you provide, and it's been wonderful talking with you again today.
Chris and I enjoyed it. Thank you.
Randy Jones, thank you so much. Needless to say, this is definitely a time that we all need to remember. It's never too late to live and learn.
Hi, I'm Randy Jones with Aging Partners. Did you know that Lincoln expects a 75% increase in the number of seniors living in our community over the next 15 years? Aging Partners is a community service that provides fitness programs to help keep older adults strong and healthy. This year, Lincoln Cares donations are providing funds for new fitness equipment. You can help make this happen. Sign up to support Lincoln Cares and add $1 to your LES bill each month.
Hi, everybody. Welcome to Live and Learn. My name's Kim Hachia. I want to thank the professionals down at LNK TV and our producing agency, which is the Aging Partners Group down in downtown, for producing the show and helping us do everything very safely. Today, we are also sort of having a big production because some folks from Bryan Health are here, and they are in the Bryan Health studios. So it's a technology wizardry is bringing the show to you today. You know, because of the pandemic, we're all having to be isolated and stay at home and try and be safe. And it's forced a lot of changes on us, but we still have to have our healthcare needs addressed. And so for many of us, we've entered the realm of telemedicine. And so today we're going to talk about that. And my guests today are Jill Hall and Andrew Whitney, and they're affiliated with Bryan Telemedicine, which provides services to about 80 hospitals in 9 states. So welcome, Jill and Andrew, to Live and Learn.
Thanks for having us.
Thanks for having us.
Thanks. Hey, Jill, can you give me the sort of elevator speech about what Bryan Telemedicine is, and maybe its history and who it serves and how it works?
Absolutely. So like you mentioned, Kim, Bryan Telemedicine is in 9 states now, serving 80 facilities. What's unique about our organization is we have over 50 unique service lines, and I'll touch on that in a minute. We began in 2014, really as a partnership between Bryan and Teledyne Health, and together we formed Bryan Telemedicine. We have a variety of service lines. We have outpatient service lines, which include things like counseling and nephrology. We also have inpatient service lines, things like acute neurology, pulmonary and critical care. So we really serve a wide variety of patients in different communities across the region.
Great. So Andrew, we talked earlier and you told me that since the pandemic has hit, that telemedicine has really seen a huge uptick. So can you give me some examples about how telemedicine is useful? I know that you told me that, you know, from the hospital in Lincoln, you can serve all these different people. So let's talk about maybe somebody in a rural community and how that would be useful for them.
Sure. So for example, one of the things Jill mentioned was a variety of outpatient services that we have. On Henderson, Nebraska is a great example. So we have a program out there where a diabetic patient can be seen by an expert physician here in Lincoln who can treat their condition, monitor their condition, make sure that they're progressing well. That's one example in a rural community. When you think about the increase in services, COVID just really exploded telemedicine around the country. We saw just in our Easy Visit platform alone, the virtual urgent care, 800% increase in just a matter of days when COVID first hit. Jill mentioned acute care services. So one of the things that was really a concern was these rural hospitals that all of a sudden were going to have to keep sicker patients because they didn't know if Bryan filled up, would they be able to transfer those patients? So we quickly brought them acute pulmonary services to manage patients that were in the local community, coming to the hospital with COVID symptoms, COVID concerns, and some really much sicker patients than normal were being kept at some of these facilities.
That's interesting. So when you talked about the person with diabetes who lives in Henderson, he or she would they access the doctor through their own home, or would they go to the hospital there to have some blood draws or whatever. How does that work?
Typically with the outpatient services, they'll come to the local hospital. So most rural hospitals have an outpatient clinic where in the past, specialists would come in and see patients there, and then they would go back to their larger urban community. Now we can bring those same experts in via telemedicine. The patients still come to the hospital. They can have blood draws, they can have x-rays and other imaging studies done there in the local hospital. The physician here in Lincoln or in other parts of the country, wherever we're bringing them in from, can review those lab results, see the patient, and provide that same quality of care as they would if they were right there in the hospital with them face to face.
Right. So is telemedicine, is it as good as or better than face to face in certain situations? I mean, sometimes you think, oh, it's sort of a last resort, but it sounds to me like it's actually becoming a first go-to. You talked about the easy urgent care. So let's talk a little bit about what patients might expect and why it is not last resort. It's a good thing.
Well, it's a good thing, first of all, because of the convenience. The Easy Visit platform is typical urgent care kind of stuff. Sinus infection, if you've had a sinus infection, you pretty much know what that is. You know what it's like. You know that you need to be seen by a doctor and you're going to get some antibiotics and you'll be better in a few days. That can be done over an interview on your smartphone. You answer some questions, the doctor reviews that, they determine what your symptoms are and can treat you from there. The quality of telemedicine is high. In our acute programs, we have telemedicine carts that have stethoscopes and high resolution handheld cameras, so the physician really can perform a very complete exam from hundreds or dozens of miles away.
I know you said that because we've been doing this now for several months, or actually for years, most physicians that participate probably have a lot of training and experience, right? So they kind of know what to look for during a...
Yeah, so our physicians, we have some physicians that's what they do all the time. They do telemedicine. Okay. And the other physicians that maybe this is an augment of their existing services, we spend a lot of time training them on the process, how to conduct an exam. If this is an outpatient clinic in a rural facility, we'll train the nurses in there how to help facilitate that exam with the physician. So there's a lot of work that goes into that to make sure that it's a high quality experience for provider, nurse, and patient.
And then how, you're director of platforms, which to me is hardware and software. How have you ensured that you're respecting patients' privacy rights and that kind of situation?
Well, the video is fully encrypted end to end, so there's no risk of something leaking out. We do not record any sessions. That really isn't a necessary thing. The documentation is done in the electronic medical record of the provider or the facility, whichever would have been done if that encounter had been face-to-face. So really, we are very top of mind as far as the whole privacy thing goes, and we feel like this is as private and secure as a face-to-face visit.
Right. So we also talked about the patient, like the urgent care thing. What kind of technology does a patient need to do this? I know if you're at the hospital in Henderson, they're going to have the interface. But if I'm in my house and I call the urgent care place, what kind of technology do I need to have?
Yeah, we found that as we spun things up in the early days of COVID, that smartphones worked really well. You've got a device that has a camera, it's got a microphone, everything's kind of there in your hand. That worked really well. iPads, typical tablet kind of things worked well. And we did have some patients that joined from a desktop or laptop that had a camera and a microphone. Smartphones probably the easiest, just because we're kind of all used to that now. Everybody pretty much has it with them 24/7. And so it's a package that has everything you need right there.
Right, cool. So Jill, I know that maybe some people might be reluctant to seek any sort of healthcare because of payment and insurance issues, but particularly with telemedicine, sometimes things seemed a little shaky, but has that changed? Is there, should people be willing to use it and not afraid because of the payment situation?
Yeah, so just like the telemedicine adoption rate with COVID really skyrocketed. You know, prior to COVID, there were some that I would consider early adopters, individuals who were curious about the technology and willing to give it a try. But there were a lot who were watching and waiting to see how everybody else interacted with telemedicine. Once COVID hit, folks started interacting with telemedicine out of necessity. And we saw something similar with the payment for telemedicine. So once COVID hit, there were a variety of waivers and different regulations that were relaxed a little bit to allow for more consistent payment and coverage of telemedicine visits. The jury's still out on how that's going to continue as, you know, we see COVID relax a little bit, hopefully, in the not too distant future. But we are very active in having conversations with individuals about which regulations and things need to remain in place to make sure that people continue to have access to care even beyond COVID, and really give that option to the consumers on how they would like to see their specialists, whether they want to drive, you know, an hour or two if they're in a rural community to go see those, or if they would like to see them via telemedicine.
So I know I sense that you guys are pretty data driven. So I'm wondering if you have any statistics or knowledge about the demographics of people that are using telemedicine. Is it across the board? Is it, you know, is it older people, younger people? I mean, who's jumped in on this? And that interests me because the population for our show is mostly like the 55 plus community. And I'm thinking they might be on board with this.
Yeah, we've really seen adoption across the board. It depends by program a little bit based on just what the demographic of that program is. You know, certain specialists will have pediatric population, some will have older, but by and large, the adoption has been pretty consistent across the board, and not only from a quality perspective, but also from a patient satisfaction perspective. And our providers also love it. It gives them the flexibility to see multiple communities without needing to travel. And they really enjoy making those connections with the individuals in each of those communities on a little more flexible basis.
Mm-hmm. Yeah, that's really interesting to me. I think we have a map that kind of shows where Teledyne is working, and obviously most of the dots are in Nebraska, but I mean there's dots kind of everywhere now, and that's a really interesting thing to me. It's interesting to me that Lincoln is kind of, you know, involved in this too. When I embarked on doing this story, I had no idea that you guys did this, and so it's really interesting, and a feather in Lincoln and Bryan Health's hat that this is happening. And I had to do a telehealth thing earlier this year, and to me it was quite satisfactory. It was very easy. I just sat here at my desk and chatted with my doctor, and it was seamless, and apparently my insurance paid for it. So it's all kind of worked out, and it's been great. You know, Jill and Andrew, thank you so much for being part of the show today. I know that people in Lincoln really value Bryan Health and all of our health agencies here in Lincoln. And I think it's really interesting that Bryan and other agencies have really stepped up during the age of COVID to keep everyone safe, and you know, to kind of you know, be a leader in this space, because I think that's very important. And I thank both of you for being here. And I want to remind our viewers that it's never too late to live and learn about how to take care of your health.
Hi, I'm Randy Jones with Aging Partners. Did you know that Lincoln expects a 75% increase in the number of seniors living in our community over the next 15 years? Aging Partners is a community service that provides fitness programs to help keep older adults strong and healthy. This year, Lincoln Cares donations are providing funds for new fitness equipment. You can help make this happen. Sign up to support Lincoln Cares and add $1 to your LES bill each month.
Welcome to Live and Learn. The Osher Lifelong Learning Institute at the University of Nebraska is one of 124 programs across the United States that offers educational programs for people 50 years and over. I'm Doug Jose. Joining me today is Dee Aguilar, who recently retired as coordinator of the OLLI program here in Lincoln. And Dee, I'm going to say right up front that I've been a member for about 10 years, and I'm a disciple. So it's a pleasure to have you here with us today.
Thank you, Doug. Thank you very much.
Now, you retired in the middle of January, and how long were you involved with OLLI? And what led you to the OLLI program?
Well, Doug, I was with OLLI a total of 15 years and change. I spent 2 years as program coordinator and 13 years as the overall coordinator or director of OLLI. And it was just by a fluke that I came to OLLI. I was working in private education, also working on my doctorate in gerontology at the time when the position opened and I saw it advertised. And I was really excited because I've always been a lifelong learner. I've worked in lifelong learning in some aspect across my entire career. So I applied for the position, and I was very fortunate to be hired as a part of the OLLI team in 2005.
I mentioned that this is a program for people over 50, but give us a little more background in terms of the mission of the program.
Well, OLLI is a program that is dedicated to providing lifelong learning opportunities for adults 50 and older. The purpose is to keep adults engaged in learning. Let's face it, after we have done all of life's necessities, we've grown up, we've gone to school, we've maybe married, maybe raised families, we've had a career, and then we retire, and then it's like, what do we do with ourselves? We want to keep our brains active because if you don't use it, you can lose it. And so the role of OLLI in a lot of people's lives is to continue learning, whether it's on subjects in the art, going back, revisiting subjects that they maybe didn't really listen to the instructor in high school or college, and picking up new information. They want to stay contemporary. So, and in OLLI here at Lincoln, I have to say arts and history are two of the biggest subjects that we find people participating in.
How did this get started in Lincoln? I mentioned it's 124 across the country, but how did it all get started here in Lincoln?
Well, back in 2003, Mr. Rod Bates, who was then the director of the NET,
sure,
a colleague of his who is the CEO of the Bernard Osher Foundation, who provides the funding behind the Osher network, they were putting out requests for proposals for existing and new startup lifelong learning programs. Well, our predecessor program, which was called SAGE, was in a period of transition. When Rod Bates learned about this potential for funding, he brought the information back to Nebraska, shared it with the leaders of the SAGE program. They decided, hey, this is a great idea because we believe the value of lifelong learning here in Nebraska has got a place and a very important part of the University of Nebraska-Lincoln. So the rest is history. The organization applied for funding from the Bernard Osher Foundation. They were awarded 4 one-year renewable $100,000 grants. And in 2008, they were invited to apply for a $1 million endowment because they had met benchmarks.
Great.
And that was when we received our first $1 million endowment.
That's great.
Lots of hard work involved.
Lots of hard work. You mentioned the Osher Foundation, but then what's the connection between that and the university?
Every Osher Institute has to be connected with an Institute of Higher Learning.
Okay.
Since our program was already in existence and had the support of the University of Nebraska, it was just natural that the program find an academic home. So their actual home is in the College of Education and Human Sciences, has been for 15 plus years. And so it's a very viable program within the university because it's open to everybody and it just brings a lot of people back to the university.
How has the membership grown over those years?
Oh my goodness. When I started in 2005, the membership was about 200 members plus a little change. And the year before COVID was the back ending in the summer of 2019, we were near 1,800 members. And then, of course, with the impact of COVID in 2020 and things, our membership has decreased, as with most Osher institutes, you know, the impact and things, because most of our programming was face-to-face, and now we're doing most things via Zoom, limited number face-to-face, and so that has an impact. But we've got members waiting to rejoin and re-engage once this pandemic is past and Ollie is up and running with more face-to-face classes. So,
well, we can't get into a lot of the statistics here, but give us a little flavor of how many courses and maybe how many hours of instruction are offered in a typical year.
Oh golly, there are probably an average at full operation, we're running over 250 courses, and instructional hours vary because courses vary from 1 time to 6 weeks or more. So there's a lot of choice, a lot of subjects, a lot of opportunities, 5 days a week, sometimes on the weekends, days mostly, some evenings.
Dee, you've had a lot of success over the period that you've been involved here. What's given you the greatest satisfaction?
You know, the greatest satisfaction for me, Doug, was watching the organization grow, watching the member engagement. I think that is the biggest reward because Ollie is very much volunteer-led, volunteer-oriented, and volunteer-directed. And so with the member engagement, I think those moments and watching this organization be built by members and staff was probably my biggest reward.
What about a challenge? What would you say was a challenge for you?
The biggest challenge was keeping up with the growth of the organization over the years. As you said, you've been a member and you've seen it grow. And just keeping up with the interest and the demand was probably our biggest challenge.
For viewers who maybe haven't participated in the program, what's the best way to learn about it and get involved? Probably through the website?
I would say visit the Ollie website, which you have up on the screen. And if nothing else, call the Ollie office, request some information. There's a very comprehensive catalog on the website that can be viewed for the current offerings and courses. And it's just a wonderful organization of individuals.
Yeah, there are five sessions per year. So there's lots of opportunity for people to
choose
among a variety of things. That I'm amazed at where all the ideas come from.
Well, I have to say that the ideas are generated by an all-volunteer curriculum committee working in subgroups, and that's a group of over 60 individuals that are arranging practically all of the courses that are offered by Ollie, the events, the travel. So as I said, it's very member engaged and opportunities for members to be involved.
Before I let you go here, we need to mention, Dee, that before you got involved with Ollie, you were involved in the parent organization for this program, Aging Partners, and you had quite a experience in the city involved with that as well.
I did. I was very fortunate to work with Aging Partners during the 1990s. And I do have to say my one most exciting adventure out of that was building at that time a computer learning center for the agency that had 2 sites and everything. And that was a major accomplishment, but also working and serving with all the seniors and things. I worked at the downtown senior center location, and it was a phenomenal experience. with all the participants, the professionals, and I learned so much. That also helped keep me going in what all I was doing.
Well, Dee, we really appreciate the contributions that you've made to older adults here in Lincoln, and we wish you well. What's ahead for Dee in retirement?
What's ahead for Dee is a lot of adventure. My first thing is disconnecting. I'm traveling out to Virginia, spend time with family. So family is my first priority.
Dee, it's a pleasure to visit with you. And again, thanks a lot for your contributions to Ollie and to the community. Remember, it's never too late to live and learn about Ollie here in Lincoln.
Hi, I'm Randy Jones with Aging Partners. Did you know that Lincoln expects a 75% increase in the number of seniors living in our community over the next 15 years? Aging Partners is a community service that provides fitness programs to help keep older adults strong and healthy. This year, Lincoln Cares donations are providing funds for new fitness equipment. You can help make this happen. Sign up to support Lincoln Cares and add $1 to your LES bill each month.
Hello and welcome to Live and Learn. I'm your host, Jerry Renaud. It's been quite a while since many of us have been practically confined to our houses because of COVID-19. One of our challenges, of course, has been to eat healthy during this time and to not get lazy about our cooking and shopping. But help is on the way. Joining us today is Aging Partners Service Coordinator Jill Engel to give us some help. Jill, thanks for coming to the program today.
Of course, thank you for having me.
We're in a bit of a challenging time with COVID-19 still very much with us, and most of us are spending probably a lot more time in our homes. And one of those challenges, again, is trying to eat healthy. It's so easy to just kind of take shortcuts and to not eat healthy like we should. I know you have some great recommendations coming for us today, but let's start at the beginning and just do a bit of review for everyone about the kinds of foods that we really should be eating. So let's take a look at what's called My Plate. You can tell us a little bit about that, and it's really a good guide for eating healthy. So tell us a little bit about that.
Absolutely. So My Plate is our visual representation of how we should aim to balance our meals. We want to try to build our plate with vegetables, fruits, whole grains, low-fat dairy, and lean proteins. Eating healthy doesn't have to be complicated, but making small changes over time can help us now and well into the future.
And My Plate gives us a sort of a pretty good example of how many fruits we should have, how many vegetables we should have, right?
Absolutely. Yep. So we want to try to make half of our plate fruits and vegetables at each meal, and getting a colorful variety of those in, about a fourth of our plate with grains, a fourth of our plate with lean proteins, and then a serving of dairy as well.
And when we talk about grains, we want healthy grains, right?
Yes.
So give us an example of what you would at least consider healthy grains and what might be not so healthy.
Whole grains would be items such as brown rice, quinoa, beans. If you look at some whole grain pastas, even substituting whole grain choices for enriched. So instead of doing white rice, consider choosing brown rice. Instead of doing white pasta, consider choosing whole grain pasta. So even those small changes can make a big difference in making sure that we're getting the necessary nutrients that our body needs.
Perfect. Okay, so let's talk about some of the ways that we might be able to do that. I mean, one of the challenges of trying to eat healthy is that we probably aren't as active as we were before because we are spending more time at home before the pandemic. We also need to be concerned about staying healthy and feeding our immune system during this particular time. And I know some of the things that you recommend is making sure that you are eating immune fighting foods, right?
Absolutely.
Let's take a look at some of those and sort of walk our way through it. It's just a small example, but again, some good ones.
Yeah, so the food that we eat can play a critical role in how our body's immune system. And when we look at choosing those colorful fruits and vegetables, the more colorful they are, the more nutrients they have in them. And with those nutrients comes those those ways that they can help boost our body's immune system. So one of this, the first thing I always think of is vitamin C, and that's going to be like your grapefruits, your oranges, tangerines, but it also does include strawberry, broccoli, and oranges as well. And
now, when we're talking about these, is it? I mean, there's lots of juices out there that you can get, but there's also the actual vegetable itself. Is it better to get the fresh vegetables and the fresh fruits?
I would say yes, because not only are you getting the nutrition behind it, the healthy nutrients, but you're also getting the fiber that comes with it. And some of the juices, they will have vitamin C fortified into them, which is great, but they're not going to have as much fiber as the actual fruit will. So consuming the whole fruit or vegetable is going to be a healthier option, just to make sure you're getting that fiber in as well.
And you do have to be careful on some of the juices because there is added sugar, right?
There is, yes. So it can be a little bit tricky. So you want to make sure to try to read your nutrition facts label and compare different juices if that's the route that you're going. But again, your whole fruits are going to be a better option because they'll have not only the fiber, but they'll tend to have less sugar and more natural sugar in it as well.
Now, the last one on there, it might be one that people go, oh, broccoli. That's for some people that can be an acquired taste. But there are some, again, creative, clever ways that you might do some of those vegetables, right?
Absolutely. And there's different ways that you can season them and cook them. And it doesn't always have to be steamed where it's mushy. You can roast it. You can grill it. You can get creative with the different seasonings. So there's different ways that you can help to flavor it to get a better appeal for you.
Yeah, grilling it is my favorite way. It's a little challenging when it's snowing out, but but that still is one of my favorite ways. Okay, let's talk about some of the other issues when you are eating at home, and that is the possibility of putting on a few extra pounds because you are, again, not perhaps as active as you might be. When you go to college, they call that the freshman 15. What if we call it the quarantine 15? Let's talk about some of the ways that we might be able to keep that from happening.
Yeah, absolutely. And I think being at home presents a lot of challenges. We're around food more than what we may have been in the past. And it's important to try to stick to a schedule as much as we can, incorporating smart snacks throughout the day, sticking with our regular 3 meals during the day, but also understanding some of the reasons why we're eating. Are we eating because our body is physically hungry, or are we eating because of our head hunger, emotional hunger? So there's different ways that we can look at combating some of the emotional aspects of it too. One of the best things I would say is to get out and try to do something different. Get out of the kitchen, get out of the dining room, remove yourself from the situation. I know that right now it's a little hard to get outside and go for a walk, but try to take advantage of the nice days that you can. And drinking water. Sometimes our body gets confused on, are we thirsty or are we hungry? So making sure that we're getting enough water in during the day can also combat some of those cravings that we might be facing.
Okay, I got a couple of quick questions for you. Then one of the items on the list was complex carbs that are good. Tell us a little bit about complex carbs, and what are good ones that we could be eating.
So complex carbohydrates are carbohydrates that it's going to take your body more time to break down, so it's not going to impact your blood sugar levels as well, but they're also going to help keep you fuller for longer. So this might include things such as whole grain crackers. So trying to pair your complex carbohydrates with some sort of protein is going to be beneficial because you're going to get the protein and then you're going to get the fiber from those complex carbohydrates as well, which in both are going to help keep you fuller for longer. So this might be another complex carbohydrate example would be fruit. So maybe pairing an apple with some peanut butter, some whole grain crackers with some cheese. or some nuts with some dried fruit. Those will all be good snack options to have on hand. That way you're still getting a lot of nutritional value from those, but you're staying fuller for longer.
Okay, so let me tell you my problem, and then maybe other people have this as well. So I'm really good until about 9 o'clock at night, and all of a sudden, I just have this urge to want to eat, and it always ends up being not the best stuff in the world. What do you suggest for my situation?
Well, I'll tell you, I have the exact same issue. That my nighttime is probably one of my worst times. And I get the sweet tooth. I definitely have a sweet tooth. So one thing that I've started to do is, first of all, keeping healthy snacks on hand. So having some fruit at night is a good way to naturally curb that sweet craving. But one thing that I've started to do also is just simply brush my teeth. And brushing my teeth will not only get that kind of that flavor in my mouth, but I'm not going to want to eat afterwards. So after I brush my teeth, I'm not going to want to brush them again. So that's been helpful for me to try to combat some of those nighttime cravings.
What a great idea. Okay, I'm going to try that tonight. All right, let's talk a little bit about shopping because I think this is pretty important as well. And I know there are a lot of people out there now that are just sort of ordering from the grocery store and picking it up, which is not a bad idea. But for those of us who are still physically going to the store, it's easy to do some impulse buying, and I am just terrible. I'm sure my wife hates for me to go to the store with her. But let's talk about smart things to do when shopping.
Mm-hmm. Absolutely. So the first thing I would say is to make sure that you have a list. Go through your cabinets, figure out your meals for the week, and make sure that you have that list when you're going to the grocery store. And however you keep that list, what works best for me is I tend to go to the same grocery store, so I know my aisles. So I can try to organize my list that way. They used to say to not shop the perimeter of the inside of the grocery store and to only shop the outside perimeter, but that's not as relevant anymore. Grocery stores have gotten strategic in how they are planning out their locations of the different food items. So
what about the frozen foods? Because I've always heard that you should sort of stay away from that aisle as well, because there's just a lot of added ingredients that go into those kinds of packages to keep them fresh.
Mm-hmm. There tends to be extra sodium in a lot of those convenience types of frozen meals. If you're choosing to go that route, the biggest thing I would say is to make sure that you're comparing the nutrition facts labels. Look at your sodium content, look at your protein content, look at your fat content, and see what the best option for you is. So, I mean, I wouldn't say necessarily that they're a bad thing, but they're probably not something that we should have all the time, and more so in moderation only.
Okay, very good. Let's talk about the creativity in cooking. I think this is important, and we had sort of a fun conversation about that. You can be creative, and it's not as difficult as it may seem.
Mm-hmm. Yep, absolutely. And I think if we embrace cooking with a positive attitude, and recipes that we can get creative with and don't require a lot of ingredients, that can make it more motivating for us to stay on track. Sometimes we're forced to, especially when we're cooking for one or two people, it can be hard to scale down the recipes to portion sizes that are going to be adequate for what you need. So one thing that I'm a big proponent of is freezing foods. And I know, Jerry, you and I had previously had conversations about chili. Mm-hmm. Chili to me is one of those things that no matter how small you try to make it, I'm always left with a lot of leftovers. And I love chili, but having it, so many days in a row can get kind of old. So I've started freezing it, And that's been a huge time saver for us. And it also helps to reduce the food waste too.
It's a great idea. And one of the things that we talked about, and I have to tell you, I tried this yesterday, just a 3-ingredient soup. It was tomato soup, and it was about as simple as it could be. It was very inexpensive, and it was delicious. And I'm not a great cook, but I liked it even. So I think those are things that you can look at as well.
Absolutely. There's recipes online or in cookbooks where you can look for three ingredient recipes, and they're simple, they're not complicated, and they don't have a lot of ingredients.
Very good. Jill, thank you so much for coming by and talking to us today. All great ideas, and I think it will make our lives better, healthier during this tough time of COVID-19. Thanks so much.
Thank you. Thank you for having me.
And thanks to all of you for tuning in today. I'm your host, Jerry Renaud. Please stay safe and healthy, and always remember, it's never too late to live and learn.
I'm Sharon Cheney with Aging Partners here in Lincoln, and wanted to talk just a little bit about winter walking, getting out in the winter, still continuing your exercise program, but without the fear of falling. Okay, so we've got a few props. We'll show you a couple of things. We have this cane with the attachment that just snaps off like that, and then they put this right there when you're not using them. It just folds right back up like that. And so that's a nice addition to your cane for safety. If you're going out and you think it might be slick, have this in your car. It's just a bottle with a fairly large opening that you can keep sand or ice melt or something in it. So when you get out, you can kind of sprinkle it around till you get the feel of the ground beneath your feet. Have you ever stepped out of your car and there, whoops, and then there you are sitting on your rear end? So that might help you with that. We've also got shoe grippers on the bottom. Yak's Trax is, I'm not promoting anything. This was just a brand that will fit over your shoe. And then leave these shoes right by the doorway because they can be slick in your house on wood floors. Also, you may want to think about how we walk. You know, some of us, we just walk real stiff and everything. Have you ever noticed penguins walk? They're always so fun. They always kind of like, they walk like this with their legs out like that, and then they just kind of waddle. But when we think of humans, we need to keep our knees a little soft and just walk slow enough, give yourself a wider base, and there you are. Some other options, we were talking about mall walking. Gateway is a wonderful place to walk because it's all indoors. Be careful coming in and out because as you step off some of those rugs, be sure that it's not slippery there. But you can also come, Aging Partners has a wellness facility, has exercise bikes, has treadmills, all sorts of activities that you can partake in. And also just think of a big grocery store. You can walk in a big grocery store. If you're out there buying things for your home, may as well just walk a few extra laps and then you're done. If you have your druthers and you don't have to be out, and there's no place you really need to get to, just hold on till the streets are cleaned a little bit more. Just kind of, kick back, walk through your own house. If you've got stairs, you can walk up and down them, you can walk around. And like I say, you might feel like you're kind of funny, but it does get you out of that chair and get you moving again right in your own home. What we want you to do is stay safe and stay happy during this holiday season and all through the winter. Just stay safe.